A lot of patients come in with nasal congestion or blockage, and it can be from a lot of different etiologies causing that. Most commonly, a deviated septum where the middle part of your nose is crooked or blocking one side of your airway, or the turbinates, which are the first structures inside our nose that swell up when we're congested. Traditional techniques for dealing with that is called a septoplasty, where we remove that blockage, or turbinoplasty, where we actually shrink the turbinate tissue, and the ultimate goal is to create a more open airway. What is often ignored, however, is something called the nasal valve. As a facial plastic surgeon, we're very familiar with the nasal valve, and we traditionally treat that with an open rhinoplasty. A nasal valve, for an analogy, is kind of like a tent pole with a canvas over it. That's how our nose is constructed. Sometimes the tent poles are a little wobbly or the canvas is very weak, and when we breathe in, the canvas pulls in, and that dynamically obstructs our nose. Now we have a real easy way to deal with that, and it's called the Lilla Implant. We basically insert this dissolvable implant under the skin or the nasal rim, and it attaches on the nasal bone and acts like a diving board. And so it creates this stiffness, kind of like a breathe right strip internally. And so when people breathe in, it doesn't block off. So a lot of athletes, people who work out all the time, complain they can't breathe through their nose. And the cool thing is that it's almost instantaneous relief on the operating room table.